Heart disease. Now, according to World Health Organization, heart disease is the #1 cause of death globally. That is, heart disease killed more people than any other cause combined. In this short video, I'm going to talk about the seriousness of disease and how actually you may be at danger not knowing that. So you don't want to miss any second of it. Let's go into it. Hi, I'm Dr. Mura, a certified lifestyle medicine physician, co-founder Dr. Mura Health. Dr. Mura Health is coming always with the tricks and strategies on how to prevent, treat, and even reverse lifestyle-related diseases. Now, according to the Heart and Stroke Foundation in South Africa, there are 225 people, South African, who die every day from heart disease. There are 10 people who suffer from stroke every single hour here in South Africa. And what is sad, but also good news about it, is that 80% of these can be prevented if people can know that they are at risk of this disease. By the way, everyone is at risk of this disease. And if they can seek some intervention early, and if they control some risk factors, some of which we have talked about in the previous videos, and some we're gonna definitely talk about more. By the way, if you have missed any of our previous videos, please go and check them out. They are for free, and they actually may change your life in a certain way, knowing your status, knowing what the little thing that you can do to change your lifestyle. So please check them on our YouTube and like and subscribe and turn that notification on. So heart disease actually begins in childhood. Studies of accidental death victims between the age of 3 and 26 found that fatty streaks, which are the precursors of atherosclerotic plaques, were found in nearly all American children by the age of 10. Of course, let's talk about American, especially their diet, what we call the SAD diet, the standard American diet, which is that it's not far different from what South African are eating today. The children up to age of 10, they find that there is, atherosclerotic streaks happening in their arteries already. So it's not the disease of someone who's older, who's 50 or 60. These changes will have started at early age. In some cases, atherosclerosis may even begin before birth. There is an Italian researcher who evaluated arteries from miscarriages, fetuses, and premature newborns who died shortly after birth, and found that arteries of these fetuses whose mothers had high LDL cholesterol levels contained these fatty arterial lesions. In addition, autopsy studies of American soldiers who died in the Korean War revealed that 77% of these young men, whose average age was 22, had visible evidence of coronary artery atherosclerosis. Some of them even had arteries that were blocked up to 90% or more. Now, this cardiovascular disease is not the disease of older people as you probably had thought of. It is actually to start at the early age. These are young people, from fetuses to young kids. Even the soldiers whose life you may think they should be up to optimal, they're having these endothelial injuries that predispose them to clogging the arteries. The good news is there's something that can be done. By looking back to what you put in your body every day. Is it artery clogging type of food? Or other habits like smoking, hypertension, diabetes that is not controlled? All these things contribute to this issue of cardiovascular disease. And we'll talk more about the causes in our next video. But remember, the simple changes from the thing that we've been talking about in the previous video in this series, there are a few things that you can start changing that can put you at an advantageous standpoint to be able to prevent these cardiovascular diseases. So thank you so much for watching. Stay tuned. We'll see you soon.